Hello everybody, good evening. Welcome to Untitled channel. Today we will speak about the third video on mechanical ventilator. The first video we speak about parameters which appear in the screen of mechanical ventilator. Second video we speak about the modes of mechanical ventilator. The third one, now we will speak about alarms. What the alarms appear on the screen of mechanical ventilators? How you will deal with this alarm? Okay, let's start. The first thing you must know what is the mode you put the patient on, or the mode the patient on mechanical ventilator. At first, the first alarm is high pressure alarm. High pressure alarm is this mean that present pressure is more than the fixed maximum BIP or peak inspiratory pressure. Okay, so the pressure which given to the patient is more than the one fixed on mechanical ventilator. The main cause for this one is air resistant. There is air resistant or blockage in the endotracheal tube which prevent the air to enter to the lung of the patient. The common cause is cough. If the patient coughs, the patient have cough on mechanical ventilator, so he resists. When he cough, he resists the inspiration of the patient, so it will give high pressure. Second thing is secretion accumulation. If you notice there is too much secretion in tracheal tube, so the patient here or the ventilator will give pressure to the patient to ventilate him, so there is resistance in the tube, so all the ventilator pressure can't go to the lung of the patient. Third thing is the patient beating the tube. If the patient beating on the tube, so at this case we need to put oral airway to prevent beating of the patient or give sedation to the patient as doctor order. Okay, the last thing is kinking. If the circuit of the patient between ventilator and the patient is kinked, so at this time the pressure can't bypass by this kinking, so at this time the ventilator will give high pressure alarm. Second thing is low pressure alarm. Low pressure alarm when the present pressure is less than fixed minimum BIP. Most common cause of this one is leakage. There is leakage in the circuit, okay, or the circuit is disconnected, or the patient disconnected from the tube of mechanical ventilator. So at this time, the mechanical ventilator will give low pressure alarm. Okay, until you know the cause or what happened to the patient, you must manually ventilate the patient by ambu bag. You connect ambu bag to the patient and try to ventilate the patient until you know the cause of low pressure. Okay. Third thing is high frequency. We know that frequency means respiratory rate. So the present respiratory rate or present frequency is more than high frequency limit. Okay. Most common cause is respiratory distress. If our patient have respiratory distress, so we need to give the patient sedation because the most common cause of respiratory distress is fever or pain or stress. The patient is stressed, so we need to adjust setting or give sedation as doctor order. Okay. The benefits of this high frequency alarm, so it will minimize tachypnea for the patient and hyperventilation, because if the patient have tachypnea, so the patient will take too much breath, so hyperventilation will happen to the patient. Okay. After that, apnea. We know apnea, this is the time the patient stop breathing. Okay. This one at this time is respiratory breathing or present respiratory rate is less than the fixed minimum frequency or fixed minimum respiratory rate, or the patient stop breathing. This happen at CPAP, mainly at CPAP, because we know at CPAP mode ventilator didn't give the patient anything, so the patient depend on himself. So if our patient is asleep or our patient didn't take his breath, so the ventilator will give apnea. Okay. Most of the new ventilator give 20 seconds to patient to adjust. So here in the new ventilator or the modern ventilator, it's give 20 seconds to let the patient take his breath or let the patient awake. So he give 20 minutes to let him adjust. Okay. After that, low O2. When the O2 supply disconnected, so we know that there is connection from ventilator to the supply of oxygen. Maybe cylinder of oxygen down in the oxygen, so this one finished, maybe this one need to change, or the connection from ventilator to auto supply disconnected, so you need to check this one. Okay. After that, high beep means that present beep more than fixed beep. This caused by auto beep when we know all there is beep in all the lungs of the patient, so this beep is the residual or remaining air in the lung which lets the lung be opened at the status of positive pressure. So more air stay in the lung, more air stay in the lung, so this one increase the stress of the patient. So at this time we can treat by increase expiratory time, increase the expiratory time to let the patient to exhale all of this air. Okay, after that, low beep. Low beep, this means present beep is less than fixed beep. It caused by leakage by circuit tubing or intratracheal cuff or tracheostomy cuff. We know if the circuit, if disconnection, or if there is any disconnection in the tube, so it will give low beep. Or if the cuff of the patient, the cuff of intratracheal tube or tracheostomy, you put air on this one to fix this one in trachea. So if there is any leak from the air in the air of intratracheal tube, so you will find the cuff this loss. So at this time it will give low beep. Until we solve this problem, so we need to put the patient in manual ventilation, but again on an ambu bag, and ventilate the patient. Okay, now we finish our video today. If you found this video is good, please don't forget to subscribe and share. Thank you.